While scar tissue certainly exists, it's our body's way of repairing broken tissue by laying down new tissue. It's often criminalized or blamed, I think, when it shouldn't be, for someone's symptoms. If I cut the top of my wrist, for example, there's going to be an obvious mechanism of injury that could lead to scar tissue. So mechanism of injury is something I'm thinking about if we want to blame scar tissue for someone's symptoms. Was there a laceration? Was there an acute trauma that was followed by not moving in a certain direction? Was there cutting like in a surgical procedure? Something that would lend itself to scar tissue being laid down in the body. Secondly, though, if the scar tissue is here, if the lesion were here on the skin, the scar tissue were forming here, I would expect that the symptoms would arrive when we put the scar tissue on stretch. Going backwards in wrist extension in this example will put the scar tissue on slack and therefore would not create symptoms. So I'm looking for and listening for symptoms that are produced when the scar tissue is actually being asked to stretch, not at rest in the most cases. If scar tissue is incriminated for some problem where symptoms are present at rest, then I start to think that the scar tissue is entrapping something. Those are situations that are very rare, just like scar tissue situations are very rare, because people tend to stretch things when they notice that they're tight in a healing phase to prevent scar tissue from being haphazard and limiting and painful. But sometimes there are nerve entrapments, for example, and in that case, the diagnosis would be like a nerve entrapment and not necessarily scar tissue. However, people often have other symptoms, and that's what I think is the problem, is again, clinicians and people who don't know are just looking at symptoms that may rule in a problem, like, oh, I have a scar here, it hurts when I do this, when I'm reaching and bending my wrist forward in daily activities, therefore it's scar tissue. But they neglect to look for, is there pain with extension, which would likely rule out scar tissue as a problem? Or is there weakness in the thumb or fingers or grip or wrist extension or flexion? Scar tissue in this easy scenario would not really change strength. Of course, if you cut muscles, it would, but I'm talking about a skin lesion in this case. So I'm listening for things in the verbal history in part 1 of my orthopedic evaluation to see if it sounds like it could be tight tissue, which I would include scar tissue in that phenomenon. Those patients, though, not only are they rare, but they're rarely presenting to orthopedic clinicians or physical therapists because they can kind of figure it out that it only hurts when I do this and avoid it, or they'll likely at home start stretching into that mobility that is restricted and painful. So I'm listening for those things. They're rare. But secondly, when we take the baselines in part 2, like I just highlighted, you can take all of the different baselines and decide if it sounds like restricted scar tissue or just restricted tissue in general is actually to blame. It should be producing symptoms when on stretch and not creating pain at rest afterwards. If I do this several times, I shouldn't lose motion, I shouldn't create pain at rest, I shouldn't affect strength, for example. That's part 3, but part 2, I'm just looking for those baselines. If I did a nerve tension test and the wrist was painful, that would likely rule out scar tissue for a skin lesion, not a nerve lesion in the wrist area. So the baselines in part 2, just like with any orthopedic diagnosis, those are going to either confirm or deny a hypothesis you have from the verbal history. And then in part 3, we can use testing, repeated movement testing, other types of tests people want to use to really assess the body and see if it meets the criteria for a scar tissue diagnosis. But my advice to people is to be very cautious with that diagnosis for the reasons I've elucidated. Look for something else, especially if there wasn't kind of an obvious traumatic injury with limited movement afterwards that would allow the scar tissue to actually be laid down in a way that motion becomes restricted and painful.